practical guidance on AMC pathway. Ma'am, we are truly honored to have you with us today, and we eagerly look forward to learn from your journey. Over to you, ma'am.
Assalamu alaikum everyone. Am I audible?
Yes, ma'am.
Okay. Can you please start displaying the slides? So coming to the AMC exam, it has two parts, AMC Part 1 and AMC Part 2. AMC MCQ, AMC Part 1 has only MCQ questions. So it is 3.5 hours exam, which is approximately 210 minutes. So then it consists of 150 MCQs. So each question will be having five options. Single best answer we have to select among the five options. And this exam has no negative marking. Like in the grading of the exam is like out of 150 questions, some will be unmarked questions. So when we write the exam, we don't have any particular idea like which question is marked and which is unmarked. Out of 150, the grading will be for 500. Out of 500 grading to pass this exam, we should get like 250. And it's not like out of 500 question, if we do like 75 questions, we will be qualifying this exam because this is truly unpredictable. Like how which question carries how many marks, we don't have any idea because we will not get any clarity regarding the markings based on like for what question they are giving how many marks are grading. So for qualifying, 250 marks are enough. It's not like you have to get 300 or 350, then you will get jobs easily, or it's just like a qualifying exam. So getting 250 is enough for out of 500 for this exam. So you will be qualified. After qualifying AMC Part 1, you will be eligible for writing AMC Part 2, which is clinical OSCE type exam. So just AMC Part 1 is for us to get to qualify and to for us to get eligibility to write AMC Part 2. Now coming to the subjects included in AMC Part 1, we have psychiatry, obs and gynecology, medicine, pediatrics, emergency medicine, and like there are no separate subjects like ENT or opthal. They are included in the medicine only. Now coming to the like we have PSM here. They are also having like community medicine, which is slight different. Like we study in depth in PSM, right? So they have only like basics covered like epidemiology and biostatistics. And the pattern from for us and them is completely different in these terms. Like NEET PG, we have a specific like textbooks and all for us to read. They have complete like Australian guidelines for every subject and topic. So we should refer their guidelines for answering these questions. We have another like extra for them. Ethics is one very important subject. Ethics carries around 12.5% because they mainly concentrate. They want a safe doctor and a person like who follows ethics and all. Because in India we don't have like any specific subject like ethics, but they give more important to ethics. Now, coming to psychiatry, there are certain guidelines. So I will tell like for each subject you have to follow specific guidelines. For psychiatry, you have RANS CB guidelines. For ops and gynecology. For pregnancy, just a second. For antenatal care and for pregnancy, you have different guidelines. South Australian guidelines and another one is the RANSCOG guidelines. For pediatrics, we follow RCH guidelines. For emergency medicine, there are only like critical situations, how to manage the patient in emergency and all. So if you do the some important topics, that's enough for the exam. Next, coming to the screening for the cancer is very important for them. Like there are certain cancers for which they have a separate book called as Red Book. For breast cancer and all the screenings when to screen based on the high risk and all, we should follow the guidelines. And we have some separate books for the for this exam. Like we have blue book, red book, this silver blue book. Blue book is nothing but AMC handbook, which is very outdated now. But there are some important questions we can do. Like it, I think total we have like 600 to 1,000 questions. We will come to know about their pattern, like how they frame the MCQs. It's better like if you start doing the MCQs rather than selecting one option and knowing why it's correct. We should know the why others are wrong. We should learn in those ways so that by solving one question, we will come to know five different options and five different topics we will learn by this way. Now, at present, Australian Medical Council has launched a new app known as eMedicine uh, for helping the international medical graduates who are preparing for this exam. for AMC Part 1 and Part 2. For AMC Part 1, I think they have nearly 4,500 plus questions. So we will get a clear idea of all these things. Like if you start solving, you will come to understand like how they are framing the questions, what are the topics getting covered and all. And for medicine, there is one more book known as John Murtha. Whatever I am mentioning, it's not like that you have to read each and everything from all these books because no one have this much time to keep on reading all the books and everything. Just you have to know the what are the upcoming like topics and recently repeated one which are asking in the part one exam. You should focus on the on that topics and learn in that depth. Going to the guidelines and solving as much questions as you can from the e-medicine. And also, this John Murtha, you have like clinical triads for each some medical conditions. You can search in that and read only that specific clinical triads part. They have separate for anything. If you are started preparation for AMC one, if you are going to learn any topic, you just have to type that topic name and you have to just enter Australian guidelines. Like I had already said, for specific subjects, you are having like specific guidelines. Just you have to type the topic name and the guidelines. That's it. So everything will be information we will get there. So for STI guidelines, also they are having separate PDF format, so we can learn from there. For asthma and COPD also they are having handbooks. National immunization schedule it's slightly different from us. So we have to look for the topics which are different for the from the Australian guidelines for to our Indian guidelines. It's not like that the everything will be different for India and Australia because the topics and the concept everything will remain the same. Just we have to focus main on the diagnosis, treatment, and investigations. What they are like, if for which conditions we should use which one. That's it. If you focus on that things, it's more than enough. Now coming to part two exam. For part two exam, it's like OSCE type, like flat two exam only. Uh, it has like in part two exam there are 20 stations, out of which there will be 16 stations. Four will be rest stations. Out of 16 stations, two will be unmarked stations. Same like part one, as I said, out of 16, we don't know which are unmarked stations. Out of 14 stations, we should qualify 9 stations to pass this exam. So AMC 1, many people are qualifying that, but the most important part is regarding AMC part 2 because there are many people are qualifying the part 1. So they want to filter many people from like by attempting the part 2 exam. So it's like out of 100 people, the passing percentage is around like 25 percentage. I mean, out of 5 percentage, there out of 5 people, only one person will pass the part 2 exam. No, yeah, I want to mention also about this thing like AMC part 1 exam. It will be available to write for us in every month except January and December. So first we have to complete the basic information like creating the AMC account. And many people ask me this question, can we write this exam during our internship and all? No, first my answer to this is first we should complete our internship because we should have our medical degree. Then only we can add it on ECFMG website and it should get verified. Then verification from our college occurs. Then after all this process is completed, we should create our AMC account, which is AMC portfolio. After creating the account, then we enter into the first step like for writing this exam. So degree is mandatory for this exam for writing AMC part 1. So my suggestion is if you are like you want to write exam after your internship, start preparing during your internship. As soon as you get your degree, then you can start doing all this process and you can book your exams. This exam like we have they will conduct like 10 months per year, right? Except December and January. So whenever you feel prepared, you can book the exam before 3 months. And one of the best thing for this exam is AMC Part 1. You can like postpone the exam. For example, you booked in March. If you are feeling that you are not prepared completely, before 1 month, there will be exam event closing schedule closing dates. So before the closing dates, you are eligible to postpone the exams. But once the exam, the scheduling closes, you are not eligible to postpone the exams. And the centers are almost all over the India. There are centers named as Pearson VUE centers where we can write this AMC Part 1 exam. And now coming to Part 2. Part 2, we can't cancel the exam once it's booked because we will be getting only like they will be releasing the slots only once a 3 months. 3 months they will release the slot. Next 3 months they will release the slots. So once we get confidence like we can write the exam, then you can book AMC Part 2. So the difference between AMC Part 1 and Part 2 is AMC Part 1 you can book 3 months before, 1 month before, or 2 months before, and you can also postpone it. But coming to AMC Part 2, it's slightly different. You can't reschedule the exam. You can't postpone the exam. Once you like book your exam, you have to go and write at any cost. Before COVID, AMC Part 2 can there are options to write from any country. But after COVID, the guidelines have changed. For writing AMC Part 2, you have to go to Australia. You have to apply visa and then you have to go to Australia and write AMC Part 2. AMC Part 1 you can write from your own country. Wherever the centers are available nearby you can go and write AMC Part 1. For Part 2 you have to go to Australia for writing that. Now coming to the resources and all, I said already there are like guidelines and all, and the best workbook for AMC Part 1 and also AMC Part 2 is eMedici. There is a separate app. You can go to App Store or Play Store and you can download eMedici. For after booking our exam, we will get like 200 free questions. But to get full access of the question bank, we have to subscribe it, which consists of 4,500 plus questions. I have a separate Telegram group I have created for AMC Part 1 students. I have uploaded this John Mutta PDF and some of the PDFs which I used during my studies. So if anyone wants to like study and wants to know about this exam, they can join my Telegram group. And even if you have any doubts later while preparing after booking the exam, you can contact me anytime. Before for booking the AMC Part 1, we were having I finished my internship in 2024. I wrote my exam in 2025. It's been almost an year. So there might be changes in the guidelines, some things. So there may be updated things which might be going on continuously. So they are mostly they love asking things which are like really updated and all. So we should always keep an eye on the things which are updated, like which guidelines, which recent any editions of the new books have been released and all. So we should keep seeing all these things. No, I think I covered almost all the things uh, regarding the basics of AMC Part 1 and Part 2. And there are separate therapeutic guidelines name thing. Like we have like each topic, what is the treatment for specific things. It is like concise thing. But some in some Telegram groups, it's freely available, I think. But we have to purchase it. Purchase this if you want access to therapeutic guidelines. It's for like almost covering all the medicine topics and the treatment for the specific topics. And many people for psychiatry and all, they also follow this Kaplan, USMLE Part 2, something. There are other books, right? So many people also follow those. And there is psychiatry is also very important subject. It's like out of all these subjects, we need to qualify almost all the subjects. If you are like borderline in every subject, you have to qualify. Like in every subject, you have to get above borderline, above 50% you should be. If out of all the subjects, if in one subject you get below borderline, it's okay. But more than two subjects, and if your percentile is 250 below 250, then you are not qualified this exam. That's it. If anyone have any doubts, you can ask me.
Jazakallah khairan, ma'am, for such an inspiring session. I'm sure it has answered many of our questions and
Yeah.
perhaps sparked a few new ones as well. One
Okay.
of the question is, does Marrow notes help in this exam?
No, actually, it's like the marrow notes, we can refer the topics and all. But as I said, the Australian guidelines are completely different from ours because in Australia, the funding for the people treatment and all, it's provided by the government. As in India, we do like many tests and all for diagnosing a disease, right? So first we have to do like basic, we have to like think clinically. And if it's relevant only, we should go for the test diagnosis and all. So they will be confusing in many ways, like what is the next step, next best step. So to know all these things, there are many flowcharts for the guidelines. So for that things, we need to study separately. You can use Marrow, but not everything. You cannot keep studying everything from the Marrow. You have to go to the Australian guidelines for cracking this exam, and most important is the e-medicine question bank.
Jazakallah, ma'am.
Okay.
Another question is duration between AMC 1 and AMC 2.
Actually, it's our wish. If you want to write your AMC part two as soon as after part one, it's up to you. And I want to add one more thing. AMC one never expires. Like once you qualify the exam, it's lifelong validity. It depends on you. The most important thing is here for you part two, which you many people are facing is getting dates for part two, because there are many people who want to write part two exam, but they are not getting slots to write the exam. That's the main important thing. So we should be prepared. We should be trying first. Some people get in the first attempt. Some people get in the second, third try to get these slots. So one of the biggest tasks nowadays is getting slots is also becoming very difficult for writing part two exam. So there is no duration like anything like you have to write within 1 year, 2 year. It's up to you. Whenever you are ready for the exam, you can write your part two exam.
The next question is, for how many months have you been preparing before booking the exam?
Actually, I want to give my exam in 5 to 6 months, but the problem was my degree was taking a long time to get verified. So I started my preparation in Feb, and I wrote my exam on October 9th. I got my results on October 31st. So almost 7 to 8 months I took before solid preparation for writing my exam. Actually, I will not say it will take 5 months, 6 months, 7 months. It depends on person to person. Individual, it's like very individual thing, like how strong you are in your concepts in your final year, and it basically it's a very individual thing, like how many months you will take to write this exam.
The next question is, which year should be AMC 1 be given and number of attempts that are allowed?
Yeah, there are unlimited attempts. But the most important thing which I will say to you all is the cost of the exam will be very high. The part one exam it cost around like 1.8 to 2 lakhs. Same for the part two. It's also like up to 2 lakhs. For the AMC portfolio, it's around 35,000. So it's almost for part one. If you are taking any extra coachings and all, it will be around 3 to 4 to 5 lakhs for AMC part one, including everything I'm saying from the beginning, like booking the exam, creating the AMC portfolio, and your passport verification. For certain steps, we have to pay amount. So approximate the cost will be it will be differing. So you have to go and check everything on the AMC Australian Medical Council website, and you have to convert that AUD into INR. You will get the exact idea, like how much it's gonna cost and all.
Okay. Next question is,
Hmm.
do you suggest self-study or coaching?
Hmm.
Um,
Yeah, it's also up to you, because if you are feeling enough confidence, like if you know about the guidelines, when to use, how to use, solving e-medicine and all, because many people will not be knowing what to study, how to study, because this AMC exam is a complete different pathway. If they are if they need coachings, there are certain coachings which you can join for AMC, or else if you are confident enough, like you can self study without any coachings and all, by solving e-medicine, by following all these guidelines, then you can go for self, or else you can go for the coaching. Same, this is also up to you.
okay, ma'am. And the continuation of that question was, can I student
Mm.
prepared for USMLE step 1 give AMC easily?
I don't know about USMLE, because I prepared AMC part one and I cleared it. I don't know like what is the syllabus, how it will be different from AMC, so I can't comment on this.
Okay, ma'am. Next question
Mm.
is, first grasping concepts and getting clarity from Marrow, then doing e-medicine 4 months before exam. Will this work?
Mm, you have to study different topics, and important I said no, like screening and all, cancer screening is completely different for us and for them, because they categorize people into mild risk, moderate risk, and high risk. For mild risk, the screening protocol will be after some years. For moderate, for 2 to 3 years. For high risk, for 1 year. But in India, we don't have like that, right? So for Australia, we have to know first the patient fits in category one, two, or three. Based on that, we will go for the treatment. For these things, you have to read Australian guidelines at any cost. And once you start solving e-medicine, you will understand what is the difference between this our Indian guidelines and Australian guidelines. Then you will self will come to know what will be the difference and how you should be start studying.
Okay, ma'am.
Mhm.
Next question is, after AMC2, will you become an Australian resident?
No, after passing AMC 2, we should get a job to work in Australia. We should get a visa and we should get a job from them, from the local hospitals, uh, like to work as a junior medical officer in their country. After we have to work for certain years, I think some hospitals say 1 year, some hospitals say 2 years. After that, we should get our PR. After getting on a PR only, we will be eligible to enter into residency. Until then, you have to wait for your PR and I mean, um, you have to get a registration there. You have to get a PR there. And after all this process is completed, then only you are eligible to enter into residency. Actually, it's a very big process.
Okay, ma'am. What about internship in Australia? Indian internship is valid and stipend, whole cost coverage of AMC 1 and 2.
Yeah, I said no. The past part, the cost of AMC two will one will be around 4 to 5 lakhs or 3 to 5 lakhs between. We have to check it once because if there are any changes for the AMC portfolio account and all, exam is around 1.8 to 2 lakhs. Same for the part two. Actually, it was 2.5 lakhs, but recently they have reduced the amount. They have bought it to 2 lakhs for part two exam. So if you calculate for part one and part two, only for the exams, you have to spend around 4 lakhs. Then you have to think about the visa and all, visa fee, then for the stay for your part two exam. So it's really, I can't say the exact amount like this much will be the amount for your exam.
Okay, ma'am.
Mm.
Ma'am, how difficult is it compared to NEET PG exam?
Actually, it's not like it's very difficult when compared to NEET PG. It's just about stratifying the things and like it's a complete different strategy when compared to NEET PG because here we are having like almost most of the topics we have an idea how many topics and from where they are asking. For AMC part one, the main thing is for AMC we don't have a specific resources and specific coachings who can guarantee us everything. How much ever you take any coaching and all, you should be studying and you should be like working hard from your side if you are having like good concepts good like solving skills and all once you start solving once you enter this pathway you will understand so it's not very difficult if you study like smartly enough you will pass this exam.
Okay, ma'am. The next question is, the students from who are from new colleges does not have ECFMG sponsor note. How can they
Hmm.
write the exam?
That's what I said. Because, however, you people will not be eligible because once your college name should be listed in WDOMS, which is the World Directory of Medical Sciences. After your college enters in that phase, then you are eligible. Then once your degree comes, then you can write this exam. So you should wait for your exam to your college until it gets listed in WDOMS website.
Okay, ma'am. The
Hmm.
next question is, what was the single biggest mistake you made during AMC preparation that you would tell every new candidate to avoid?
Just to stop running over unnecessary resources, unnecessary platforms, unnecessary coachings. Study everything, like start concising everything from the beginning. Like start making notes, everything from the beginning. You start your preparation from AMC part one and keep revising. Do as many MCQs as you can. Just solve. I solved almost all the AMC handbook and most of the questions of e-medicine. So I can't say everyone to solve 4,500 questions because everyone will be having different times before their exam. So it's up to you, like how much you can solve. You can try to solve those many questions and
Okay,
practice
ma'am.
as much as MCQs and study. Just revise all the important and recently asked topics which are going to ask from these coming recent months and all. That's it.
The next question is, kindly suggest online coaching platform. I think it's e-medicine.
Hmm. Yeah, no, it's
Then,
not a coaching platform. It's just a question bank. Now you can search regarding this. I will message you personally. You can say them because we can't say the coaching platform names here, like online. Like we can, because there are many things I can't suggest. Like you can go and watch this one. So it's like you have to go and you have to decide by yourself. Like because the cost will be very. I don't know different coachings, because if I suggest one, if it's not good, then it will be not useful for you guys, right? So
Another question is about alternative pathways.
alternative pathways for.
Uh, for AMC instead of AIMS.
It's up to you. Like if you want to go for UMC, it's your choice, right? If you want to stay in India, then it's need PG. If you want to go to UK, it's FLAP. So alternatives means, see, it's not like we are not writing need PG, then we will go and plan for Australia. I'm suggesting this to everyone before entering a pathway. Just completely know every each and every details of AMC, because many people will think that NEET PG is very tough, so we will go to the AMC pathway. It's not like that. AMC is also very time taking pathway. It is a very long pathway, because nowadays many people from different countries all over the world, many doctors are applying for AMC. Many people are qualifying part one. Many people will study and qualify part one, but it's very becoming very difficult for them to qualify to part two. So if you are ready for everything, then only enter into this pathway. So you should mentally prepare. First, you should question yourself why I am taking this AMC pathway. Why not NEET PG? If you are interested, if you are want to go to any other countries to complete your residency and everything, then for that thing you have to think about like Australia or any other countries. It's not like Australia is the only country. There are many countries which have entrance exams and all. You should choose the one which fits to you. It's not like the everyone is doing this one, so I will go and do all these things. It's not, it will not work in this way.
Okay, ma'am. Another question is which would be the best year in MBBS to start preparing for AMC or after internship?
It's up to you when you want to start your preparation for AMC, because when I was preparing, I don't have any idea regarding AMC. I want to just give my NEET PG and do my MD or MS in India. But there are some circumstances which I changed my mindset and I wrote my AMC. Because my college was also the first college which was not listed. So I thought it may take me how much time I will don't know. So I don't want to waste the time. I thought of giving NEET PG. But as soon as I started my preparation for NEET PG, luckily my college got listed. So I have to change my pathway from NEET PG to AMC one. So luckily, with my hard work, I wrote my exam and Alhamdulillah, I passed in my first attempt.
Okay, ma'am. How many years will it take to be a resident and when can we start earning after AMC too?
Actually, before some years, after AMC Part 1, many people were getting jobs. So many people were moving to Australia. They were doing their jobs and simultaneously preparing for Part 2, because many people from India, they go before doing PG, right? So they want to do their residency there. But now the jobs are really unpredictable. So I can't say this many years you will get into residency. Everything should work out for you, because many people are not getting jobs nowadays that much easily. So you have to find yourself a job. You should go there. If you get the part after part one, if you get the job, that's very good for you. You can start earning after part one only. But nowadays it's like becoming very difficult. So have to clear your part two. Then you have to apply for the job. Then you should get selected. After selecting, you should work for there for minimum 1 to 2 years. After that, only you are allowed to enter into a residency. But if you join for observerships and all in certain hospitals, then you will not be getting paid. But like if you join like a proper job type, then only you are paid in those hospitals.
Okay, ma'am. The next question is which recalls did you use? Also WBA pathway.
Actually, work-based assessment is a different pathway, so I don't have any much more idea regarding that. Uh, and what was another question?
Uh, which recalls did you use?
Recalls, see, some the people will be messaging like something these topics were asked. So I used to read complete regarding all the topics, what were recent topics asked, which were the things. And most people like they always fall for these recalls and all, but the options will get changed in the exam. So we should like sometimes be smartly regarding these recalls and all. Because sometimes we think that this might be the answer, but he will change something in the question and the answer will be completely different. So
Okay, ma'am. The next question is marking system for step two.
Marking,
Is
as I
Indian
said already, yeah, I explained. No, it's out of 24 will be rest out of 16. The marks will be completely different. It's up to the examiner how they are marking 3, 4, 5 out of like complete 14 stations. You have to qualify nine stations to pass this exam.
Okay, ma'am. The next question is, how did you use clinical guidelines while studying? Please give examples.
Actually, I have not followed for every topic the clinical guidelines. Like I had almost a good understanding of all my final year subjects. So the topics which I don't know, the treatment and all, which is somewhat different from our topics, where solving the questions and all, which I was doing many questions in the specific topic wrong. Only that topics I referred the specific guidelines.
Okay, ma'am. The next question is, the year 23, this year 23 colleges are
Mm.
registered in WDOMS,
Mm.
but does not have ECFMG sponsor note. Can they appear for exam?
I think you should once go this complete information in IMC website because I don't have like a complete idea about this because my college got listed in the W rounds and also it has ECFMG sponsorship also. I think you should be having ECFMG sponsorship also, but you have to check it once. In AMC guidelines, it's completely written everything like in website, what are the things, what are the rules and all. So you should go and check that one.
Okay, ma'am. The next question is, after clearing AMC Part 1, can we get into internship in Australia, and can we get stipend or salary?
No, actually, I think because they prefer their local doctors more when compared to us. So I think even if anyone want to do the internship, it's very like long process, and also I think we have to pay some money or something. I think so for doing internship there. Many people say that it's very difficult. So many people suggest like to complete internship in our own country from our own college before like entering into this procedure. It would be good.
Okay, ma'am. The next question is, after AMC 1, there are few hospitals in which if you work, you don't need to renew your temporary license. Is it right?
I don't have any idea regarding that, so I can't comment on this question.
The next question is, what options after AMC 1?
You can start applying for the jobs and simultaneously you should start preparing for the AMC too because you don't know when you will get the job, when you will start earning. So it's better while preparing for part two. Also, you start working in your own country as a DM or something. You should start working in any hospital and you should start also preparing for AMC part two.
Okay, ma'am. The next question is, what clinical skills we can develop during MBBS to perform well in AMC Part 2?
Actually, AMC Part 2 is a complete like OSCE type, so the stations and everything are completely different. Just we need to, in during our MBBS internship, whatever cases we are getting exposed to, at least we should have specific idea and particular idea regarding all those things. But AMC Part 2 coming to that because patient communication, everything is a complete different way. When we speak to our patients and them, there are certain guidelines what to ask, what to tell, and also for that we have to go in a complete different way. So just start learning and try to learn as many as clinical skills and things you will know because everything will not be a physical examination. Some will be like outside of the exam room. There will be a screen on which there will be a question posted. You have to read the question. For each station, you will be allotted 10 minutes. 2 minutes for the question reading, and you have to enter the room. Whatever things are said on the screen, like what to perform, some things are done to be done on the patient, some to be explained to the examiner. So the physical examination tasks are only two to three, I think. Remaining are like counseling of gynae cases. So everything is not like clinical skills. Some only 2 to 3 stations.
Okay, ma'am. The next question is, how long did it take for you to get a job after AMC 1? Or did you have to wait till AMC 2, and what in between?
Just I cleared my AMC part one. Now I am working in India only. I have not planned for AMC two yet. So most probably I have to start my preparation. And I have not start applying for any jobs till now in Australia. I will be start now. I will start applying after this my fellowship gets completed.
Sure. The next question is, can you give an brief overview over how to start the preparation for beginners?
Like if you're like almost try to start if you're planning to write your exam as soon as your internship finishes, then start doing the questions and all. Then you will get some idea like what is the topic, how they are asking, how they are framing the questions and everything. You will get minimum idea of like how our studies should be different from these things like to clear the exam. Then after some by solving only you will try to get their like main concept and all. And they are having this AMC handbook also, which I posted in my Telegram group. You can go look through that also. There are some questions which are updated, outdated, like screening and all. Remaining apart from those which are outdated, you can refer to the another topics. You will get some clear idea, like what are the topics which they are asking, and how they are like framing the questions. Why this is the option is right, why the others are wrong. So once you start solving, you will come to know. Rather than I say do this, do that, you should start solving the things. Then only you will come to know.
The okay, ma'am. Jazakallah. The next question is: even after completing AMC two, is there any surety we will get a job?
There is no surety for anything because nowadays the competition is so high. You have to wait. That's it. If you are like very keen for this pathway, then you have until you get the job, you should try. You should be doing job in your own country because for our to clear our expenses and all everything, you should be keep working. Once you get like once you get the job, then you can move to Australia. Till then, you should keep working in your home country.
Okay, ma'am. The next question is Indian internship valid in Australia?
Yeah, Indian internship is valid, but post internship experience matters a lot because they want doctors who are like clinically doing without any like pause after their internship. So internship is valid, but you have to keep working after your internship also.
Okay, ma'am. The next question is it possible to do fellowships before PG?
Fellowships are like to get some experience and all. In only India, in certain hospital, it's valid. It's not valid. It's not valid in other countries. So for gaining experience, if you want to expose to different cases and learn many things, it's okay for our country, like to work in our hospitals and all.
Okay, ma'am. The next question is I heard as we answer a question in the exam, the next question will be tougher than the
Mm,
answer.
yeah.
If our
Mm,
answer was right and if answer was
mm.
wrong, the next question will be easier. Is that true?
Yeah, actually, I said no, it's a completely computer-based test. So if you answer first question, if for example, first question is easy and you made it right, the next question will move it to medium level. If you made it right, then the next question will be on the higher level. If you made that wrong, then it automatically the next question will be easy. So it's completely unpredictable and it's completely computer-based test. So we can't guess like even if many people write on the same day, some people will get some questions and the things will be different from person to person. And yeah, it's right. Like the mode of the difficulty will changes based on our answers to the questions. Many people say,
Thank you, ma'am. The next question is can't we give NEET PG and AMC simultaneously?
yeah, you can give NEET PG and AMC because once you if you qualify your NEET and you get the good rank, you can do a PG here. If you write AMC part one, then you can if we after we do our PG, just AMC one is enough. But after PG, they also need some experience because we come under specialty and all right. So they need much more experience for them. We can skip part two if we write our NEET PG here, but we need post NEET like PG experience for that.
Okay, ma'am. The next question is how to make CV more attractive.
There are many like Australian websites where there will be like some formats posted. You can go and refer those websites for making CV.
The next question is 1 year of preparation enough to clear part one?
Completely depends on person to person. Can't comment on like the time duration. How much will you take? Some people may clear in 4 to 5 months also. So it's completely individual.
The next question is AMC clearance is just to get a
Mm.
job in that country. Can I not get a PG seat there with that exam?
No, after you qualify part one and part two, if you want to do your residency in Australia, you have to qualify both part one and part two. Then only you are eligible to enter into residency.
The next question is, which is the best time to enter an Australian health system after UG or PG? Which is easier?
Actually, many people say some say UG, some say PG because but post PG they are asked. Many people are saying that they are asking many years of experience. So for UG also they are asking some year of experience. For PG also they are asking. So I can't comment like which is the best pathway to enter and all.
Uh, the next question is, how many years of experience post PG?
Don't know. Some say three, some say five. So it maybe differ from person to person because if we attend the interviews, if they get impressed, even for us with 1 year of experience, if we are lucky, we might get a job with 1 year of experience also. Some get the job with 3 years, 5 years. So it's completely we can't say like with how many years of experience.
Okay, ma'am. The next question is, can we clear AMC 1 while doing job?
It depends like for how many hours you are working and how much time you can take out to prepare for your exam. If you are able to manage for both of your job and exam, it's good. Then you can go for start while doing the job. You can write your AMC one. But if you are not finding time and all, you can start working for some months during the initial phase of your preparation. During when the exam is clear, like near like 1 to 2 months, then you can take off like completely focus on your studies.
Okay, ma'am. The next question is, how to get a residentship there after working as a junior doctor? Is there any exam
No,
again?
there will not be any exam again. Just you have to write your part one, part two. You have to get a visa. In residency program, there will be like in which part of the specialty you are interested in. You have to apply to those colleges. There will be only interviews. You have to crack the interview. If you are selected, then you can enter into the residency.
Okay, ma'am. Jazakallah for the questions. I think
Mm.
it's been long, and I'm really
Mm.
sorry if I have missed some of your questions. Uh,
Yeah.
Jazakallah khairan, ma'am, for such an inspiring
Okay.
session.
Thank you so
Allah.
much. Thank you, everyone.
Jazakallah, ma'am. Now, as we come to end of this session, I would like to thank IMSA. IMSA has been creating and arranging sessions like this and has helped us so much in our personal growth and self upliftment and the upliftment of our deen. Alhamdulillah, as we come to end of today's session, all praise is for Allah subhanahu wa ta'ala who facilitated this gathering and blessed it with beneficial knowledge and meaningful discussions. Our heartfelt gratitude to esteemed speaker Dr. Arshiya ma'am for sharing your time, experience and valuable guidance with us. We are so grateful to you, ma'am. A sincere thank you to all our participants for your enthusiastic presence and also for your patience. If and I'm really sorry if I've missed some of your questions. Now, and at last, I would extend our appreciation to the IMSA leadership, our organizing committee, especially Sakina ma'am, volunteers, and technical team for making today's session a success. May Allah ease our journeys and may Allah put khair and barakah in whatever paths we desire. Ameen. Jazakallah
I
khair.
mean, Allah Hafiz.